Dr. Elliott, you are now recognized for 5 minutes to provide your testimony.
With the Recruitment, Retention, and Relocation Bonus Program and beyond. On June 12, 2025, the OIG released a report on the Recruitment, Relocation, and Retention Incentives Bonus Program. The OIG highlighted several problems with the administration and oversight of the program that AFGE agrees with. Chief among the problems identified is the failure of VA human resources. While VA did use this tool to recruit and retain clinicians, there were problems in how the bonus program was managed. AFGE has previously criticized the HR modernization that the OIG is citing here, agreeing with the conclusion that it has led to increased turnover at the VA. Additionally, AFGE believes that HR not being in the facilities and lacking familiarity with the workforce and the veterans they serve increases their turnover. This undermines the ability of HR to serve employees as well as administer the bonus program. In preparation for this hearing, when contacting the Hampton VA, we could find no repository of data to show who has received these bonuses. However, after reaching out directly to 800 bargaining unit members at our hospital, AFGE had 9 bargaining unit members who reported that there were 4 recruitment bonuses, 4 retention bonus, and 1 relocation bonus awarded between 2021 and 2025. While AFGE is pleased that at least 9 employees received these bonuses, we have no way of knowing if this benefit is properly utilized compared to the rest of VA. Regardless, I can say with decades of experience at this facility that there is significant room for improvement, both at the hospital and the brand new North Battlefield Outpatient Clinic, which opened this year, 27% staffed. We urge the VA to use these bonuses and other tools to increase capacity at the clinic and the hospital. Beyond the bonus program, AFGE has other suggestions to improve recruitment and retention. As the committee is aware, in March, President Trump signed an executive order eliminating the collective bargaining rights of 1.5 million federal employees at agencies, including VA. Continuing to deny large swaths of the VA workforce collective bargaining rights will continue to harm recruitment and retention. As there is a critical shortage of clinicians in this country, many quality candidates who want to serve the VA may avoid the agency to receive both union protections and better salaries in the private sector. This is particularly egregious as Secretary Collins played favorites when choosing whom to exempt from the executive order, not by job description or duties, but by which union represents the employee in question. AFGE members lost their collective bargaining rights despite having identical jobs to employees who were exempted and retained their rights. AFGE urges members of this committee to support H.R. 2550, the Protect America's Workforce Act, which would nullify this illegal executive order. AFGE has long argued for the benefits of telework for employees who can perform their duties remotely. This is particularly true for clinicians who practice in whole or in large part through telemedicine. However, since most telework has been rescinded by this administration, many clinicians have had to report to a VA facility and then have been required to interact with patients remotely, often in crowded bullpens discussing private matters. This has harmed morale and retention of mission-critical and hard-to-recruit clinicians at the VA. This has negatively affected retention at Hampton and reflects VA's overly broad approach to telework and telehealth. I hope that my testimony today leads to this subcommittee to help improve recruitment and retention at the VA. Thank you, and I look forward to answering your questions.
Dr. Elliott, I want to first thank you for being here and taking time away from your day job as a pharmacist at the Hampton VA Medical Center. I understand you're also the caregiver of your mother. Is that correct? Yeah. Well, you're a superwoman, and I'm really grateful for your participation and your continued dedication to your VA brothers and sisters at the AFGE. You mentioned in your testimony that there's a lack of clarity in how and when 3R incentives are used at your facility in Hampton. Do you think that if 3R incentives were made widely and frequently used at Hampton, the facility would be able to onboard and keep more employees?
We used to have a process whereby we had hard to recruit and hard to fill positions at our facility. I do not know where that process is at this time. I have not heard anything of it for the last several years now, especially since we've been decentralized with respect to the HR staff. But that is supposed to be the, those people on that list are supposed to be the designees of various recruitment, retention, bonuses, and so forth. In my 35 years there, I've never seen a relocation bonus for a line staff person, no matter what their job was. Typically, those had been reserved for top management, the various relocation bonuses.
Yeah. And Dr. Elliott, I wanted to ask you if you had any reactions to how the Secretary is characterizing staffing at North Battlefield Clinic, since you're on the ground actually working there.
And I can tell you this from the standpoint of a veteran. I go to, this is what the veteran said during a panel. I go to the VA at North Battlefield, have my primary care appointment. However, if I want to receive other services, such as x-ray and those sorts of things, I still have to drive to Hampton. That's problematic.
That is. Well, thank you, Dr. Elliott.
Based on your experience, has the VA's approach to collective bargaining helped or hurt your ability to attract and retain staff?
I would say that it has. We have been, I guess,
It has
reduced our ability to recruit and retain. It has. But I also would like to say, if you don't mind, this situation about the 30,000 employees that are targeted as far as a number goes. In 1989, I met a nurse named Miss Eddie Ricks. She told me that a failure to plan is a plan to fail. You probably have heard that. When you rely on random reductions, there can be danger there. You don't know which critical and which non-critical position is going to be reduced. So let's say, for example, if out of that 30,000, 10,000 of them are doctors, we can't tolerate that. Or if 15,000 of them are nurses, we can't.